Good morning, everyone. Thanks for joining us for Fall Prevention for Caregivers and Older Adults. I'm Calvin Hu with Family Caregiver Alliance. And before we get started, I'd just like to say a few words about our organization. Family Caregiver Alliance has been working in the Bay Area and the nation to improve the well-being and also the quality of life of family caregivers. We offer support by providing a number of services and resources, most at no cost, which include consultations, classes, workshops, publications, and we also do advocacy work locally and nationally. To learn more about Family Caregiver Alliance, please visit us at caregiver.org. Now, your phones and mics are going to be muted, so if you have any questions, you can ask them by using the Q&A box on your screen. We'll be answering as many questions as we can at the end of the webinar. At the end of the webinar, I'll also be asking you for some feedback, so I'd like to thank you all in advance for filling that out. And finally, the webinar will be recorded, so if you registered, I'll send a link out to view the recording. And that'll take maybe about a week from today. So today I'd like to welcome our guest, Tricia Catiggay. She is an occupational therapist with over 40 years of experience. She's worked in many settings, including acute care, rehab, and has worked with a variety of people with health challenges impacting their daily lives, from pediatrics to gerontology. She's worked at Stanford Healthcare for the past 15 years, working in injury prevention under trauma services, and is involved with the fall prevention programs offered by Stanford. Tricia also shares caregiving duties with her family in the care of their elderly mother who has moderate dementia. So now that you know a little bit more about our guest, I'd like to turn things over to Tricia.
All right. So thank you so much, Calvin. And thank you, Family Caregiver Alliance, for inviting me to have this presentation on fall prevention for caregivers and older adults. So let's go ahead and get started. So next slide. So let's take a look at some of the facts regarding falls. So among older adults, falls are the leading cause of injury, deaths, and the most common cause of hospital admissions due to injury. So it is the most common reason why our older adults come into the Stanford ER. What we know too is that 1 in 4 adults had a fall in 2018, and that translates to about 36 million falls. And out of those falls, 3 million required medical attention. The costs of falls in 2015 were 50 billion. So it's something that we do need to be concerned about. We do know that 95% of hip fractures are caused by a fall. And other consequences of falls are traumatic brain injury, spinal cord injury, spinal fractures, chronic pain, fear, and debility. We do know that yes, falls can happen, but if we identify the risk for falls, then we can reduce the risk for falls. Another interesting statistic is that every 20 minutes, an older adult dies from a fall in the United States. But falls are not a natural part of aging. Next slide, please. So those factors that contribute to falls, there are some factors that we are unable to change, and that is your age. We know that you're over 65, you may be at risk for falls, that there are chronic conditions that may lead to falls. And if you have a history of falls, like if you have a fall within the year, you're more likely to have another fall. So those are things that we can't control, but we do know that there are risk factors that we can address, and what we know what works. So what I'm going to talk about is take a look at, so it's important to get yourself assessed medically. Is there a reason why you're falling? To make sure you have annual vision exams, medication review, home assessment and modification. I'm really going to focus a lot on that. We know practicing safe behaviors will reduce our risks, and of course, physical activity. So let's go ahead and turn the slide. So what's really important is to have your vision checked on a regular basis, because what we do know that changes in the eyesight can cause problems with glare, sensitivity, light, dark contrast, and more. Because what we do know that as we age, our our vision can diminish. So vision is very important to observe obstacles in your way. And if you can't see it, you can't avoid it. So we do know that vision is really important for balance. I also want to add that hearing is also very important, um, um, as far as a sense that you need in order to reduce falls. Because if you're walking and you can't hear cars or you can't hear bikes behind you, there was a study that was done several years ago that took a look that even moderate hearing loss can increase the risk for falls. And what we also do know too is that multifocal lenses can increase fall risk. So if you use trifocals or bifocals, you have to be extra careful. I know for myself, I wear progressives. So when I find myself going downstairs, I do notice, you know, the figure ground is a little difficult, so I always hold on to the rails. So let's go ahead to the next slide. Another risk factor for falls are medications. So what we do know that as many as a third of all falls in older adults may be related to medication problems, because there might be some interactions between those medications. So what they say, or what the research say, four or more medications can increase fall risk. And in that particular research, they took a look not only at prescription medicines, but your over-the-counter medicines, your herbals, things like that. So that if you're taking four or more of those, that can increase your fall risk. So it's very, very important to take your prescription over-the-counter vitamins and herbals to your doctor or the pharmacist for review. I find that the pharmacist is very helpful because, you know, they've gone to school for years and years to look at all the different interactions between medications. And what we do know regarding like the medications that you're on for blood pressure, that those can cause problems with balance or dizziness or lightheadedness, which is not to say not to take your medications, but to be aware of the side effects. And it's always a good idea to review those medications that you take with your doctor on a regular basis, because as we get older, I mean, sometimes I have people say, well, I've taken this particular heart medication for years and years and years, and I've never had any side effects. I like people to be aware that um, that as we get older, the medications may synthesize in our bodies a little bit more slowly. So you may find side effects may pop up, whereas you've never had side effects before. So let's go ahead and go to the next slide. Here's where I want to focus on, and that is home safety. So what we know is that more than 50% of falls happen in your home, not, you know, in a new place that you've gone or to a neighbor's house that you're not familiar with, but in familiar places. So it's really important, like you'll see there, there's a rug that has a little crimp in the middle. That's an easy trip hazard. You want to make sure that you remove clutter and cords from your pathways. Make sure your rooms are well lit. Check each room to make sure that it's a safe environment to go into. And of course, if you need to, install grab bars in the shower, because we know that the bathroom has a lot of slippery surfaces. So let's take a look at some of these rooms in particular. And what I'd like you to do is go ahead in the next slide. So I have a bathroom here, and what I'd like you to look at is think about what are the hazards in this bathroom? What do you see? What needs to be addressed? I'll give you a moment to take a look, make note of it. You can kind of make note of it to yourself, or if you want to chat, you can. But you'll see that there is, yes, thank you. The, thank you. So there are rugs that are on the floor, towels on the floor, the hair dryer cord is in the pathway. There are no grab bars. There is a scale that is at the end of the tub. Yes, I think, and you'll see that there's no chair in the shower. So, what can we do to make this bathroom a little bit more safer? Well, we can put a grab bar for the entrance into this tub shower. You can put a shower chair in there. And I didn't take a picture of what it looked like after we had taken all those hazards out, but there is a grab bar in the as you enter it, and another grab bar on the side. I see a mention of a high tub. You're absolutely correct. At this time, this person has a shower chair, but it may come to a point where it's going to be really difficult stepping in and out of that high tub. So, what you can do, and then I've had other people do this, is they take away the sliding door of the shower. They will put a curtain rod there and hang a shower curtain on the curtain rod. It's like a expanding curtain rod, and you drape the shower curtain over it. And then you can use what is called a bath bench that can sit the legs. There's like two legs that are outside the tub, so you don't even need to step into it. You just sit on the chair and then scoot yourself over to take your shower. Also, what you can't see, there's also a what do you call it? A shower head handle. So the person who showers in here can sit in their bench and hold the shower and bathe themselves. Um, you'll notice, yes, you did talk earlier. I did see something in the chat that talked about the towels on the floor. So, and putting a rug there, because I know it is important to have a rug in there, because we do know that you don't want to get water on the floor and slip on them. To make sure that you have a rug that has a non-skid surface on the bottom. Now, sometimes people have said to me, "Oh, I like to throw it in the washer to get it clean." And sometimes people will say, yeah, so, and then the bottom, the rubber part comes off. You can get, if that's a concern for you, you can buy at, I think, at Target or Walmart, one of those rubber matting that you can cut. And this is actually what I did in this particular bathroom. Is I had some rubber matting and I cut it. I had a rug that I cut it to the size of the rug, and I put my foot on it. Or put the mat on, put the rug on top, put my foot on top. And if you can put your foot on top and kind of wiggle it, and it doesn't move, so you know that that's a good rug. Someone mentioned about the toilet. Yes, it's a low toilet. And so if you need to, you can put a raised toilet on there, or one that has railing on it. Okay, I think we're done with the hazards in the bathroom, and we talked about how we can make it a little bit more safe. So let's go to the next picture, the next slide, and let's take a look at the hazards in this kitchen. So go ahead, take a look. You can put it in the chat as to what hazards you see in this kitchen. So there are newspaper um, on the floor. I know that, when you're cooking on the stove, you don't want grease or anything to splatter onto the floor, but having a non-skid rug would be on there. Yes, getting up on the chair, it definitely is unsafe. I always tell people that you want to put your most commonly used items within easy reach, that you don't have to step on anything. Um, you can have, a family member or someone help you to organize your your cabinet so they are within easy reach. If you do need to use a stool, make sure you get one that is specially for climbing up on. And I always tell people to put get a stool that has one of those handles on it, and you want to make sure that the stool is pretty sturdy. Sometimes people use like what is called a grabber or a reacher to get items for light items. But again, my most common tip is to make sure that you have um, keep those items within easy reach. Yeah, the lighting is a little bit dim in there. It could use more lighting. You'll see that there's a garbage can um, in the way, so away in the pathway. I don't know if you can see in that picture, but kind of underneath the sink beyond the chair, there's a rug that's a little crumpled. Again, make sure you get a rug that has a non-skid bottom on it so that it doesn't slip. And it is important to have a rug underneath there, because when you're washing dishes and the water gets on the floor, you don't want to slip on that. You're correct. By in front of that, what is that? That dishwasher. There are pet dishes in there, so it's in the way. So if you had to go to the sink or unload the dishwasher or get something from those cabinets that are on the left, there's a towel hanging over the stove. I mean the oven that can be removed. The other thing that I want to mention too is that a lot of times when we're trying to reach, and this is why, again, I like to keep those items that are in your kitchen within easy reach so that you don't have to overreach or crane your neck to get something. So I do tell people that you want to avoid, if you do reach into your cabinets, to kind of keep your chin within neutral, because if you think about it, if you tilt your head because you're looking for something in the closet or in your cabinet and you keep your head tilted, you have carotid arteries right here. And when you sustain this kind of movement and kind of rummage in your cabinet or what have you, think of these carotid arteries. When you tilt your neck like that, it's like a garden hose. And when you put a kink in your garden hose, that impedes the water flow, right? Think about it. If you impede the blood flow here in your carotid arteries, sometimes that's why when people have to sustain keeping their neck up, they get a little dizzy. And that's the reason. So again, another reason why to put things within easy reach. And sometimes I have people say, "Oh, it makes my counter look messy if I put things on the counter." But again, safety. Um, so yes, I wanted to mention too, those pet dishes, kind of move them off to the side, or can they be, off to the corner of where that refrigerator is. Okay, you guys have got it. Let me see what else. I wanted to make sure anything else as far as hazards. I know the biggest one is getting up on the chair, but how many times have we done that out of convenience, right? So keep your stool close by. All right, so let's go ahead and next slide. Let's take a look at the next room. Okay. This is the family room or living room. What are the hazards in this room? What do you see? Yeah. So there is clutter in the way. The shoes, the papers on the floor, you've got the cord running across the pathway. And you're right, there is a narrow pathway. I'm glad somebody picked up on that. So what I would do there is I would open that up a little bit, kind of move the chairs so that there is more of a space to move between there. The chairs are low, and so sometimes what people have done, if you've got a couch that's too low, besides getting a new couch, they'll take a piece of plywood and put it underneath those cushions. So you'll see you could put that under that sofa's cushions. Or have you ever seen, I've seen them at Bed Bath and Beyond, at Target, those little risers that you put under dorm beds or under beds so that you can kind of put stuff underneath. People have done that. They under those feet will put those like little risers, and it will kind of give you maybe several inches of height. And that little armchair that's to the left, that's low too, and it's a little bit of it's a rocker. So I probably would replace that chair to something to raise that up, a different, more sturdy chair. And yes, you could build a platform from the couch. The other thing that might be hard to notice is you'll see in the corner, there's that lamp. And think about if you had to traverse across this room in the dark to turn on the light in that on that lamp. So I would recommend another lamp or a night light to illuminate let's say you want to go into this room and watch TV instead of walking in the dark, have a lamp or light for entry onto that room. Great. Yeah, a lot of hazards in here. All right. So I think let's go to the next slide. And this is our last room. Okay. Hazards in this backyard. I know it's a really nice open area. There's not a lot of stuff that's in this patio area, but what are the hazards here in this backyard? There is clutter on the steps. There's that cord that's running across. You can see there's a cat that's behind that patio door, or I should say, sliding door. Yeah, that's in the way of the entrance and exit. There's no railing there. You would need to open the curtains a little bit just that you can safely go through there. And there's cracks in the sidewalk here that could be a tripping hazard. So, you could repair those cracks, install some railing there. And I always like to put, railing on both sides, taking away the clutter off the steps. And that's sometimes I see often when I do home safety assessments, whether there's steps outside or steps inside, that people like to put like in the landing, or even sometimes on the steps themselves, like decorative items like a plant or something like that. So I always like to have clear steps, clear landings when you go up and down steps, and make sure you have good sturdy railing. Okay. And I think I said rolling up that hose too. That's another way of improving. Okay, so let's go ahead and let's go to the next slide. So as we know, as we looked at these different rooms, simple changes can make a difference. And here are just some samples. So you'll see in the bathroom picture, there's grab bars, The toilet is a little bit more raised, and you can put grab bars there, or have a raised toilet with the arms already connected to it. You'll see a sample of railing that can be put outside the porch. Grab bars, you'll see it. There's a picture of a grab bar. And a lot of times I tell people, if they want to put grab bars in, see if you can get one that has a textured surface, because sometimes I've gone to people's homes and they tell me, well, the surface of the grab bar is a little slippery, so I got to really make sure that there's no water on it. Or I take a washcloth and I hold onto the washcloth and hold onto the grab bar. Well, if you get a grab bar, and they do sell them that have a textured surface, then you'll be able to hold it much better. On that right top picture, there is night lights that you can put in your hallway. So if you have to come down the hallway to go to the bathroom, there are night lights. There's a variety of night lights, which I didn't realize that are motion censored, that are triggered by the darkness. And then on the bottom there, you'll see that that slippery reversible bath mat is really unsafe, and you want to make sure you pick a mat that has non-skid backing on it. So making those changes to help our homes be more safe to navigate in and to reduce falls. So let's go on to the next slide, and let's talk about, oh, here's another, pets. Pets can also be a hazard, but they're really important for our health, aren't they? So you want to make sure that pet dishes, toys, the litter box is off to the side so that they're not tripping. I know for myself, my cats leave toys all over the place, so I gotta pick them up and kind of put them off to the side or keep them in a box for them. I had one lady who told me that her dog, while she was washing the dishes, her dog would be quiet and we'd be right behind her. And she had almost tripped several times because she didn't realize he was behind her. So what she did is she ended up putting a bell on him, just like you put a bell on a cat. So when he came, she would hear the bell, and she would know that he was there. So she'd be kind of extra cautious. Another thing with her dog too, he slept in the same room that she did, but he kind of slept in different places, like sometimes on the bed, sometimes on the foot, sometimes in the little doggy bed that she had. And sometimes she was afraid that she would trip on him in the dark. Now, I told her to go ahead and put a night light in her bedroom. But what she also did is she put one of those glow-in-the-dark collars on him, so that when she had to get up, and I told her, take your time in getting up. Don't rush, right? Because you've been laying down for a while, and now you got to make sure you're okay to get up. She would kind of locate where her dog was by this glow-in-the-dark collar. So those are just a couple of tips for you. So you got to be careful with your pets, especially if they're hungry. I know my cats will kind of weave in between my legs when they're hungry. And of course, if you have dogs who are excited to see you, so let's say you were out of town and then you're coming back and the dog really wants to jump on you. What I used to tell people when I used to work at the hospital, when they were returning home and being discharged from the hospital, if they had a dog, I said, your dog is going to be really excited that you're home. So when you go home, have your family member or friend put the dog in another room. You come in, have a seat in the chair, and then let the dog out of the room, and then they can be happy, and they won't knock you down, right? So if you're sitting in the chair, so be careful with your pets, because they can be trip hazards too. All right, let's go ahead and let's go to the next slide. And then another risk factor is looking at our own personal habits. So if you're wearing footwear or flip-flops, there's a pair of flip-flops there, and I remember I had a pair that was on sale, but I noticed that when I wore them, my feet slid around in them, and it was like, this is I was reluctant to get rid of them because they were on sale and they were awfully cute. But you do want to make sure that you're safe. I ended up getting rid of them, so that's good. So, um, so those personal habits, wearing footwear or shoes that are not well fitted, shoes that have no backs on them. Like, I know a lot of times we want to have comfortable shoes when we're home, and those scuffs. Those are really bad. Climbing on chairs, we looked at that earlier, and even on ladders and other behaviors can increase fall risk. So if you find yourself, I know for myself, as I'm getting older, I'm not very comfortable getting up on a ladder. So I ask somebody else to get something for me. Or if I have things that need to be done on the roof, I hire somebody because I can't get up on a ladder anymore. I mean, these unsafe behaviors can increase fall risk. Another thing too is rushing and not being mindful, not paying attention. I've heard of so many people, and I've done this myself. I've only tripped, but I've had people who fell over the when you park your car and there's those parking stops, they're thinking of, oh, okay, I'm at the market. I gotta make sure I get this. I gotta make sure I get to the post office. I gotta get there. And they trip over that parking stop. So again, rushing, not being mindful, trying to do too many things at the same time are those personal habits that could increase our fall risk. And it's really difficult to sometimes change some of these personal habits because they're ingrained in us. I mean, if you're the kind of person who's used to multitasking, you need to slow down, do one thing at a time. I know of people who, when they enjoy walking with others because it makes the walk more pleasant. But I had one lady who told me, I had to stop walking with friends because I would talk with them as I'm walking and I would always trip. So she walked by herself. She also said she started to become more mindful in her walking because one time she was walking in her neighborhood and she saw a kid doing basketball tricks, and she was walking and looking, thinking that's really cool, and then she fell. So I mean, I do the same thing. I walk in the neighborhood, I see beautiful flowers. Now I stop and I look at them, admire them, and then go your way. So doing one thing at a time. So those habits that we have. Um, let's go on to the next. All right. So what's really, really important is strength and balance are important in order to stand tall, lift your feet, and regain balance if you begin to trip. So what I wanted to do for this presentation was just show you a few very simple exercises that you can do at home. So let's go ahead. And you're never too old to exercise. Sometimes I hear that from people. Oh, I'm too old. But we do know you could be up to your 90s and still reap the benefits of exercise. It makes you feel better. There was actually a study that was done in Navarre, Spain, that did take a look at 90-year-olds and put them on an exercise program, and they found that I can't remember if it was 6 or 8 weeks that they did gain strength. It was easier for them to get in and out of the car, up and down from the chair. So we do know the benefits of exercise. So again, never too old to exercise. Let's go on to the next slide there. So here is one of the exercises I wanted to show you, ankle circles, to work on stability when you do your walking. And I always tell people there's a certain way I want you to do these exercises. I want you to sit tall in your chair, just like this person is doing in the chair, holding core in, sticking one foot out and making really big circles, just 5 times one way and then 5 times the other way, really nice big circles. And then picking up the other foot and doing 5 circles one way, and then 5 circles the other way, and that's it. Don't do two feet at the same time. I always like to focus. It's part of being mindful and really focusing as much range of motion as you can in that ankle. Now, here's the rationale of why I think ankle circles are so important for stability and working with flexibility. So if you think about it, your ankle joint is the first joint that detects and responds to the change in the terrain. So think about it. The ankle joint is the first joint that detects and responds to the change in the terrain. So you want to make sure that, like, if you're walking, in your neighborhood and, they got those cracked sidewalks, or if you step on something that, messes with your balance, you want to make sure that if you step on something, that the ankle feels it and adjusts, makes those adjustments. So that's why I tell people to do ankle circles. They're very simple. I do them all the time in the car, sitting at the doctor's office, maybe even at the market. You put your toe down, and as you're waiting, holding on to the cart, you just circle your heel around, just to really work on your ankle. And you may notice that one leg has better motion than the other if you do more do more I got, because I saw that question. Yeah, ankle circles, do them wherever you can. I tell people at least twice a day, and you can kind of do them anywhere, watching TV, right? Okay, so let's turn the page, or turn the slide, and let's look at the next exercise.
Tricia, sorry, I just had one
Yes.
quick,
Yeah.
just since it's a clarifying question. In
Yeah.
terms of the ankle circle, you just want to isolate that ankle, right? So only
Exactly.
the foot and the ankle, so the leg is going to stay straight,
Yes.
presumably relaxed, but only the ankle is moving, right?
Yes. Thank you so much, Calvin, because that was one point that I always like to make too when I talk to my participants about that, is keep your leg as still as possible. I say as still as a statue, and only the motion of the ankle is moving. You're right. So thank you for interrupting me. No, that's good. So 5 times one way, 5 times the other way. Now I tell people, because I had one lady who said to me, "Oh, Tricia, my leg really hurt after I do these ankle circles, or my calf really hurt." And I had asked her, "How many did you do?" She said 25. I don't do 25. If you want to do 5 to 10 ankle circles, that's fine, but don't do more than that. You don't need to go crazy with these. This is, I mean, sometimes people say, that seems so simple, but sometimes some of those exercises that we do for balance and strength are some of the most simple exercises to do. You don't have to do anything too heroic. So the ankle circles. So thank you, Calvin, for asking that question. So we can go to the next slide, and we can take a look at strength and flexibility and marching. And you'll see here that you can stand and march, hold on to the kitchen counter and march your legs, or you can sit. Again, sitting away from the chair, nice and tall, and just marching your legs up and down. It's not important to raise your leg really up high. You just want to do it to comfort level. And I always tell people, no, don't go too fast. I mean, doing this, that's nothing. That's just momentum. I tell people when they do this exercise, just go nice and easy, nice and slow, because then you're really working on the muscles. And I also tell people too, is when you lift your leg, don't just drop it down, deliberately bring it down. So you're not making a bunch of noise with your feet. It's soft steps. So that's nice and controlled, working on the muscles in the front of the leg and the back of the leg. And again, this is an easy exercise that you can do while watching TV, while at the grocery store, holding on to the cart. Really good for hip and knee flexibility. And sometimes people will, you can even, you can march, or you can even, if you want to really work on your balance and really work on strength, do 10 times just the one leg. You'll notice that there's a difference. It's harder to do than just regular old marching. One side and then do the other. So you can do, where you alternate, and then you can kind of bump it up a notch by just doing the one leg. So that is your marching exercise. Again, when you do it in sitting, sit nice and tall. Don't slouch against the chair. I tell people, don't, if you need this for your back, if you need the support of the chair behind you, yeah, go ahead and lean back on the chair. But if you're okay, sit nice and tall and do your marches, okay? All right, so that's the marching exercise. All right, so let's take a look at the next slide. This is actually one of my favorite exercises. And actually, the research shows that this is one of the best exercises for strength and balance. And it's really simple. It's your sit to stand. There's a certain way I tell people to do this, because sometimes for some people it's easy to go from sit to stand. And when they sit back and down again, they kind of just let go and you just kind of plop in your chair. I don't want you to plop in the chair. I want you to focus on standing up. And then the emphasis is on nice and slow sitting. As if there's an egg on your chair and you don't want to crack the egg. Make sure that you're breathing nice and easy as you're doing this exercise, because you when you do the exercise, because you want to because you're doing something hard, if especially going really slow, that you want to make sure that you're breathing nice and easy. And when you're going slow, you're really working on your quad strength, the hamstring strength, and the glutes. So that's why I like to tell people to do this exercise maybe, 5 or 10 times, 10 reps, several times. Again, the research shows that this is one of the best exercises for balance and strength. And I'll tell you, what, I had one lady who lived in the hills, and she did this faithfully. And when I saw her, maybe about a year later, she told me that she felt that she got better strength in her legs because she lived kind of on a hill and she had to walk her dog every day. And walking up the hill, she found that it was easier to go up and down, because going up that hill. And again, you think about it, see those muscles in the back are the ones that are propelling you up. So sit to stand, and that's one of the best exercises for balance and for strength. Let's go ahead and let's go to the next slide. Okay, so there are different options, as far as getting into an exercise program. You can community and virtual exercise programs. There's a program called Matter of Balance, and I don't know if you have that offered in your where you're at, but this is an evidence-based class to particularly look at people with the fear of falls. But they look at fear of falling, they look at fall attitudes, they look at assertiveness, home safety, things like that. And these classes are either done in person or they do have them virtual over Zoom. There's the YMCA. I don't know if there's a YMCA close to you, but online there's YMCA 360. I can't remember. It used to be in the early part of the pandemic. It was free. But I don't know, they may be free again. There's Sit and Be Fit that's on public TV, or you can get a DVD of Sit and Be Fit. They actually, in my community, it comes on channel 17 at 9:30, and I find myself doing them. You can sit and do the exercises. They're very simple. There's seated yoga offered at various senior centers. And I always think of, because people sometimes say, well, if I vacuum the floor, is that considered exercise? You know what? I consider that's a functional activity, that yes, you are getting some exercise. So any kind of functional activity, which includes light household chores like folding laundry, drying dishes, putting away dishes, sitting at the table and chopping up vegetables. I mean, you're using your arms, you're using your balance to stay upright. I think those are all very, very important. So, keep that in mind. That's okay too. All right. So I'm coming down to my conclusion here. Let's go to the next slide. So making changes to prevent falls. So in conclusion, so talk about falls and near falls to your health provider, because there may be a reason why. I mean, I had one lady who told me that she had regular these falls that were happening, and so she would write them down when they happened, what she was doing, and she would take it to her doctor, and they would try to figure out, okay, what's going on? Do I need to order an additional test, something going on with your health? So it is very, very, very important that you talk to your health provider. Make sure you get regular vision and hearing exams, because we do rely a lot on our vision to keep our balance and make sure our hearing is good. Make sure you look at your prescriptions, even your over-the-counter medicines, your herbals, your vitamins, your minerals. Talk to your doctor or talk to your pharmacist about what fall risk effects can come from those medications, and are there any interactions with them, because there are certain medications that will interact with each other that may increase your fall risk. Take a look at your home. Go through your home. Make sure it's safe. Make changes and home safety modifications. And I know it's difficult. I mean, I had one lady who told me, I have this really beautiful rug that I got overseas. I want to enjoy it, and I have it on the floor. So we talked about how else can you enjoy this rug? And she decided, well, you know what? I'm going to display it on the wall. So it's a matter of sometimes, what can I do differently? Sometimes people say, I don't want to put those grab bars in my bathroom because they look too hospitally. There are a lot of options as far as grab bars are concerned to make it, to make them look nice. Keep your feet healthy and in supportive footwear. So you want to make sure that low heels, that it's a well support, your foot is well supported. That also too, sometimes I have people who have favorite shoes, and so they wear them all the time. Well, when that happens, the tread on the bottom starts wearing down, and now the shoe is not giving you the support. If you were to walk and have a little slip, you don't have that tread. And a lot of times people will say to me, oh, Tricia, shoes are really expensive. I especially to get the good shoes. Well, the thing is, yeah, they can be expensive. Look at sales, but how much more expensive is it if you fell because of your footwear? And I've had people who have fallen because of their footwear. How much more of cost to be in the hospital or psychologically, because of footwear. So, look for sales. And I always tell people too, if you find a good pair of shoes, maybe buy several, and then you kind of you alternate their use, so then they don't wear out as quickly. So keeping your feet healthy, good supportive footwear, and then participate in a regular balance and exercise program. It's maybe 35 minutes of exercise or activity is good enough. And even if you exercise snack, the research say that's just as beneficial, because sometimes, we have health problems that we can't, maybe we can't do a 30-minute exercise program, or, walk for an extended period of time. Even if you do like 5 minutes, or let's say you get out of bed, before you get out of bed, you do your marching, 30 seconds. And then you get out of bed, you use the bathroom, you stand at the sink, wash your hands, and then maybe after washing your hands, you may rise up on your tiptoes and do maybe 10 reps of that. And then you stop, walk to the kitchen, and, make your coffee. And while you're getting your coffee heated, maybe you stand at your kitchen counter and you sidestep. So those little bits of exercise are very helpful. I know for my mom, what I have her do, she walks out into the backyard, and going back into the house, there are these little steps. And so before we go into the house, we just go up, we do those little step up, step down, step up, sit down for a few reps, and then she goes in. So those little bits of exercise are very, 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 very helpful. Okay. So that, I think, concludes my presentation. In the next slide, I mean, there are resources. I know that Calvin is going to show you some resources, but I found one that's by the NCOA, National Council on Aging, caregiving.org, and they have a little there's a little brochure on falls prevention conversation guide for caregivers. So that looks really nice, and it's a nice little a little handout. There's also techenhancedlife.com, and their technologies for aging in place. So they're actually doing a seminar series right now that takes a look at, you know, what medical alerts are good, technology to help avoid medication adherence problems, what are the right tools to minimize social isolation and loneliness. So again, techenhancedlife.com is a really nice website. But I thank you so much for sharing time with me this morning to talk about falls prevention and caregiving. Thank you.
Thank you, Tricia. Just first off the bat, to remind everyone, we will be able to get everybody a recording of the webinar. So if you registered, you won't have to do anything. I'll make sure to send it out to that same email you got the registration from. Now, questions, lots and lots of questions. First off, we have someone who wanted to know about walkers. Actually, a lot of older adults, a lot of caregivers that have a lot of experience with people using walkers. So they just wanted to know, when you know, they're walking with a family member who's using a walker, is it best to be behind them, to the side of them? What would you recommend in terms of just trying to make sure, you know, kind of spotting them as they walk?
Yeah, I would walk to the kind of off to the side of them. I don't know. I guess it also depends on how much they assist that they need. If you need to give, you know, a handhold assist to make sure that they're steady with the walker, or if they are pretty steady with the walker, I always like to walk off to the side of them. I know that sometimes if you're walking on the sidewalk, and this happens with my mom, is I'll be behind her, but I'll be looking ahead. And what they say is when you are walking, the safest thing to do is to walk with your gaze at a 45-degree angle so that you can anticipate any bumps in the sidewalk. You don't want to just look down at your feet and walk, but anticipate any obstacles so that you can avoid them.
Thanks. We have another listener who wanted to know about someone who has fallen, I guess, in past, and is kind of a little bit afraid to, you know, maybe move around because, I mean, you know, they've injured themselves. So I guess what might you recommend to encourage them to move? Because I think a lot of people, they might get a little gun shy, but then of course, the less you move, the greater your risk of falling.
Yeah, you're right. I mean, it is a vicious circle, because I have seen that in people where they have had falls, and we do know that, and then they're afraid. We do know the fear of falling is also a risk factor for falls, because if you are afraid of falling, you're not going to get up and move around. But then when you do, you do have to get up and move around. We were made to be moving creatures, right? So you then again are more because you've gotten weaker. So I think for that is to really analyze, you know, so if there's a certain activity that you want to do, think about, well, how can I do this differently so that I can do this safely? So and have them, if you want to start out with light exercise and sitting, that, I mean, that's great. I'll give an example. Like I had one lady who she enjoyed going to the movies but she stopped going because it was very scary for her to go. So then what she did is she took a look at, well, what I can go with a friend, or I can go to the matinee so that there's light, or I can go early so that they won't have the lights off. And when they turn the lights back on, I'll leave the movie theater late. So you can kind of, so you can kind of analyze the activity that it is that you want to do and try to think of, well, is there a different way of doing it so that I feel more safe and more supportive? And the nice thing is when you do that and you're successful, then it opens you up to, well, I did that. That was okay. I can do something else. I don't know. Did I answer the question?
Yeah, that's yeah. That I think it's just a way, maybe ways to think about how um just different ways of thinking about the problem so they can, hopefully get to the outcome that they're as safe as they can possibly be. So yeah.
Yeah, safe and doing uh um and enjoy something that you really enjoy. I mean, it's not fun being in fear.
Mhm.
Yeah.
Okay. We have another listener who want to know if there's any I guess videos or links that you might recommend in terms of the subject. Does Stanford have any information? And then I guess if not, where they might go to learn more information, because you mentioned like a matter of balance, and I know Stanford does a number of these programs, so where they might find more information about that.
Probably on the Stanford website. I think the fall prevention or injury prevention. I mean, I think it does mention some of the classes that we offer that are virtual. Right now, the in-person classes that we do are in the South Bay. So in like in Sunnyvale. Um, and I think we're looking ahead at doing offering more in-person stuff, but they are more, more in our area. Are some Zoom classes like bingo size and matter balance that will be up and coming. So I would say go to that website. You might also look at your own senior centers, what they have to offer as far as fall prevention programs, because I know as far as like for matter of balance, for bingo size, for stepping on, those are programs that are national, um, and in all sorts of in different places. So not just Stanford. And I don't know. I'm not aware of what's happening in up in San Francisco.
Okay. And I think we have time for just two more questions. I did want to get this one question because she answered just about when we started with the question section, but this is a listener who has, I guess, difficulty walking on some of these sidewalks with, I guess, bumped up. So maybe, it's older. We know a lot of our sidewalks are not great, perfect flat slabs. So maybe there is a slight, 18th of an inch lip between sidewalks. Maybe they're cracked. Or you have many other hazards. Maybe they're weeds or it's slippery if you live where it's snowy. But in terms of walking around, getting that exercise, staying healthy, are there any recommendations you might have for just people who might find themselves maybe more or less prone to falling or tripping when they're walking on some of these sidewalks that are not, maybe not great sidewalks, quality sidewalks?
Yeah. So when and earlier I showed you that slide with the ankle circles. I would say that especially do that exercise because the ankle circle, like I said, the ankles are the first joint that detects and responds to the change in the terrain. Part of walking in a kind of an uneven surface is to really pay attention and to be very mindful, looking ahead, like I said earlier, in a 45-degree angle. But of course, you don't want it to be a fixed gaze. You're kind of looking around, just like if you were driving a car. You don't just look right in front of you. You kind of look at your um, mileage, your how fast you're going, what's off to the side. So really paying attention when you're walking, and especially if you're going through an area that's a little bumpy, that's trip hazards. I mean, other people have told me, well, I go to the mall. Of course, you have to deal with if there's a crowd there, but they don't have to deal with bumpy sidewalks, or going to a high school track. I've had people do that too. They walk the track. So think about other alternatives that you could do.
Okay, thanks. And I think just one more question that I actually personally want to ask. If, say, you have someone who's taking care of
Mm,
a frail loved one or family member, friend, um, and say, you walk in and at that point they've already fallen, right? They're on the floor.
mm,
And I guess in this instance, if the person is themselves maybe not in a physical condition where they can, just go behind them and lift them up. And I don't know,
mm,
maybe that's not the right answer. What would you advise them in that situation? Maybe, I know there's lots of variables, but say if you, run into maybe a couple and one of the couple has fallen and the other one is
mm.
maybe not so physically able to lift them up. Or again, maybe is that the right thing to do if someone's taken a bad spill to just try and lift them up right away? What would you recommend?
Well, what I would recommend is because, when we fall, it's really embarrassing or feels humiliating. And so sometimes our incline and people are uncomfortable if they find you on the floor. So they want to grab you and heft you up. But you want to be very careful about that. You want to make sure that it's okay for that person to move and first move. So I always tell the person, can you just stay there for a moment? Can you move your arms? Can you move your legs? How is your head going? Kind of talk them through, because I had one lady who told me she was at a senior center and she was embarrassed, and she had her daughter help me get her up, and her daughter just kind of hefted her up. But what they didn't realize that she had actually fractured a bone in her leg. And what she told me is that the fracture became worse when she got up. So again, you want to really wait a moment, assess the situation, make sure that it's okay for this person to get up for first of all, um, and then if there's any doubt of your mind, if you're not sure as to how to get them up, I always call 911 and let the professionals get them up. And I know in our area, if you just tell them I'm okay, I just need a lift, I don't need to go into the hospital, they will just get you up and into bed if that's what you want to do, as long as you don't do it every night. But the general rule is that you want to, if you're okay to get up, then you can have that person roll over onto their side, onto their hands and knees, bring a chair to them, have them put their hands on their chair, get their legs underneath them, and then you can, if the caregiver is strong enough and able to hold the pants to kind of lift them up so they can get up and then turn around and sit on the chair and take a deep breath. Do I need to call the doctor? Do I really need to go to the ER? But that's a great question. You want to bring a chair to them and see if they can get up onto their chair. But if you're not quite sure, if you're not sure if you're, because you don't want to hurt yourself too, because I've had that happen before too, where the wife fell down and the husband said, "Oh, honey, I'm going to help you." He pulled on her arms to pull her up, and their hands fell apart. She fell down back again, but she was okay. He was the one that really got hurt because he kind of pitched himself across the room. So you don't want to have the caregiver hurt themselves. If there's any doubt in your mind, to call 911 and let the professionals get you up.
Great, thanks. And yeah, people should not feel embarrassed or that they're making an
Yeah.
imposition on the fire department. Or I mean, that's really, they're there to put out fires, but also to help people.
Yes, they are.
Okay, perfect. Well,
Yeah.
I think that's all the time we have for now. Thanks everybody for joining us this afternoon. I know everyone's got a lot of things going on and a lot of responsibilities, so we're very grateful you spend the afternoon with us, and of course grateful that Tricia could come by and share her expertise with us.
Yeah. Thank you for
Um,
having me.
so these webinars we do are free. We do them every month. Next month we're talking with Dave Iverson, who's another former caregiver. He took care of his late mother for about 10 years. So he's written a book about it, and we're going to talk with him kind of about the book and kind of what he's gone through in his own caregiving journey. That'll be at the end of March. You can find out more about our webinars on our website, which is again caregiver.org. Before we go, I will put up a little poll for everyone to fill out. But again, I'd just like to thank you all for joining us this afternoon. And thank you, Tricia, for joining us. And again, everyone for joining us today. So we hope you stay safe and be well. And hopefully you can do your ankle circles, and you can take what you learned from today and maybe share it with a loved one or use it yourself if it's applicable. So I'll get the poll started. Thanks everybody for participating. But I know Tricia's got a lot going on, so she's gonna be leaving us. But I'll keep the poll up, and if you have time, we'd certainly love for you to fill that out. So thanks again, and have a great afternoon.